So this is an x-ray of Sonia's tooth. So here you can see these bright white pieces right here. So this is where a root canal was done. So these are the canals within her root. And pretty much what happens is they are cleaned out and filled in with this material here. Once that's done, especially on a molar, the tooth is going to need a crown. So that is what we are going to be doing today, is prepping this tooth for a crown. So the first thing that we're going to do today for our crown prep is place some topical anesthetic. So that's what this is right here. And we're going to put it right on the cheek side of this tooth right here. And that's going to give a little bit of anesthetic to the tissues. Now that the gel has been sitting for about 5 minutes, we're going to take out the cotton, and then we are going to anesthetize the tooth. And this is called Septicaine. It's the local anesthetic that we're using. We're going to put the anesthetic right up by where the end of the root tip ends. That's where the innervation is.
So we're gonna make a form over her tooth, and I will use that as a template towards the end of the appointment when I have to make a temporary for her. And here it is. It is a thermoplastic. I have it in some water. It's kind of like Play-Doh. It gets soft and very moldable right over the tooth. Literally molding it right over the tooth as I want it, and then I'll put some cold air on it and it makes it set. And she's already getting numb. Also, this piece of plastic is a little bit warm, so it feels comfortable to her. Here it is in one piece. Got the exact imprint of her tooth, and we just set it aside until we're ready to make a temporary. So next we will check the shade of her teeth because we want her new crown to blend right into her smile. So go ahead and open a little bit, Sonia. I kind of look at all of her teeth, not just that surrounding area, to make sure it blends. And it sure does. Very nice.
Okay, so this is an intraoral camera that we're going to use to take a picture of Sonia's tooth before we start prepping it for a crown. So go ahead and open, Sonia. So here we can see her teeth, and here's a good shot of the tooth. So that brighter white color is where a temporary filling has been placed. That is where the endodontist, which is the root canal specialist, went in and accessed the nerve to do his root canal. So now that Sonia is nice and numb, the next thing that we're going to be doing is taking off about 1 millimeter to 1.5 millimeters around the entire tooth, which creates enough space for our zirconia crown that we're going to be placing. And we have various sizes of burrs right here. They're kind of the equivalent of a drill bit if you're used to construction. So there's different sizes and shapes depending on what angulation I'm working on and where I am on the tooth. So that's what these are for. This burr that I'm using, and the burr is the piece right here that goes into my drill. So the nice thing about it, it is thick enough. It's about 1 millimeter, and that lets me know how deep that I need to go when I'm drilling. So it's kind of one way that I can kind of gauge that I'm taking enough tooth structure off when I'm working. So the next thing that I'm going to do is use this red wax to check to make sure that there is enough clearance between the tooth that we're prepping and the lower tooth, so that the lab has enough space to make the zirconia crown. So Sonia, go ahead and open. So what we're going to do is have Sonia, she's going to bite down all the way into this red wax with her back teeth, and then grind around a little bit, and then open. And we can look to see, to make sure that it's not too see-through, and it looks great. Looks like we have enough room. So we are ready for the next step, which is to place a retraction cord around the tooth.
So we are going to place a retraction cord around Sonia's tooth. This holds the gum tissue out of the way for approximately, or it treats it for about 5 minutes, and then we'll take it out right before the final impression, and it enables the lab to see exactly where the margin of the tooth is. That's the way you get a nice result of a nice crown, where the margins of the crown fit the margins of her tooth perfectly. So by rolling this retraction cord just underneath the gum, open a little bit, it creates a little bit of space and it pulls the gums back just a little bit. The gum tissue acts like a collar around the circumference of the tooth. It's like a turtleneck. And I'm just rolling this piece of string right underneath there, and it creates that space. It'll just sit there for a little bit.
So now that it's been 5 minutes, we're going to take the cord out from underneath the gum. And now we have a clear vision of the margins of the tooth, so we can take an impression. Okay, now that the cord is out and the tooth has been rinsed and dried, we're going to take our final impression, which is what gets sent to the lab for the crown to be manufactured. And this is called the light body impression material. It gets a little bit, takes a better impression for the details. So we're gonna put this around the tooth directly. And while I'm doing this, Simona is over there, she's loading the heavy body impression material. And this is called a triplicate impression tray right here. So it's loaded with the heavy body. So we're gonna place this right here, and we're gonna have Sonia bite down all the way with her back teeth. One bite down. And she's gonna stay just like that with the tray in place for about 5 minutes.
Perfect impression, good job. Our next one will be another little impression, although it only takes 1 minute, and it registers to see how your bite comes together. And then over her newly shaped tooth, clicks right in. So we've got the temporary crown, mostly all shaped. The importance of having a temporary crown on here is so it protects the tooth. Because we've shaved down 1 millimeter around the circumference of the tooth, most of the enamel is now gone. So open a little bit, and by placing this little cap or a little coat over the tooth, it protects it from chewing, you know, the foods, and also from sensitivity. Now that it might be a little bit hot and cold sensitive, essentially that covers it. But most importantly, we want to cover the tooth because the temporary crown maintains the space in between the adjacent teeth. If there is no contact in between there, then the teeth tend to collapse inward, so we don't want that to happen. It is important when wearing the temporary crown during the 2 weeks that you avoid things that are sticky. So things like caramels, taffy, anything that has that pull and might challenge the temporary cement that we're going to have underneath the temporary crown. Also, you don't want to floss too vigorously. If you feel like you're catching an edge, maybe pull the floss out the side instead of yanking the floss back down, and then potentially you can pull the crown off. But overall, the crown is very strong. You can eat all the normal foods. You can have meats, chips, seeds, all the normal things that you typically have. It's going to be very strong and hold up for it. That's all.
Okay, so now that we have our temporary as well as our bite registration, and Sonia is in her temporary, we are going to send these to the lab, and it will take them about 2 weeks to manufacture her crown. So we will see her in 2 weeks to put on the permanent crown. Okay, so it has been 2 weeks and Sonia's crown is back from the lab. So here we have it here. This is a crown that is full zirconia. So as you can see, both the outside and then the underside do not have any metal in them. So it is a full white crown, and zirconia is a very strong substrate, so that's great. So here we go. Right here, I'm just going to try it on the model. We have this model here. This is the prep, which is how much tooth we took off. And then we're just going to kind of put the crown on here so we can kind of see how it fits. And that looks like it's going to look great. So the next step is for us to try it in Sonia's mouth.
Okay, we're going to take off your temporary, so go ahead and open. I just need to put a little pressure right here by the gum line. Tilt your head a little bit towards me. And it literally breaks the seal and pops it right off. Next, we're going to make sure all the temporary cement is off her tooth and everything is clean. And then we'll be trying the permanent crown on.
Okay, now we're going to try in the crown and check the contacts between the adjacent teeth and make sure the margin is all sealed with the tooth. So what we're going to be looking for is we want the contact to be kind of snappy, not too tight. but that the teeth are actually touching. So there's that great contact that we want. We're gonna have Sonia bite down, and that's going to mark so we can see where the teeth come together. Go ahead and bite down, Sonia, and grind around a little bit, and then open. And we're gonna check. We want to make sure it's not biting, hitting too hard. In Sonia's case, because she has a crack underneath there, we're gonna take it so it's kind of light on the biting surface in this case. Okay, and then lastly, I'm going to check the margins of the tooth, which is where the crown meets the tooth. That's what the margin is. So that is all looking great. So what we're gonna do next is take an x-ray to make sure that the places that I can't see are in fact properly sealed. Okay, so here we took the x-ray so we can see that the margins are sealed where we want them to be on the sides of the tooth. So we should be all ready to go to cement this crown. So we are now going to cement the crown. So here we go, we're gonna give the tooth a rinse. So this is fast setting cement, so it only takes about 1.5 minutes to fully set. Fully down. I'm going to put a little pressure on here. And then we're going to have Sonia bite all the way down on this cotton. Go ahead and bite down, Sonia. So lots of pressure. Hold just like that. Takes about 1.5 minutes. Okay, so it's been 1.5 minutes. So we are now going to remove the excess cement. You can see along the margin right here, there's some excess cement. So we'll get that off. Okay, we're going to do a final rinse and take out this triangle here. And that's the end. Okay, thank you for watching our video on how to do a crown. If you have any other questions, please leave a comment down below. Thank you so much.